This issue came up during the PERCAT. A couple of elders sitting behind me wanted me to address it. And in my 8 years on council, I have voted no on every adoption because I've seen a tribal member get enrolled with 1 over 256 as far as blood quantum. And I didn't think that was fair, because in turn, what happens is those example would be scholarships. We have a scholarship for tribal members, and if there is a Cheyenne out there with 1 over 256 blood quantum that has never set foot on the reservation or has never seen our homeland, and we're giving them $6,000 to someone who grew up here, who needs that scholarship to go to college, I think there's got to be some preference there. And what this blood quantum thing has done is it's gotten to a life of its own. I think we need to amend our ordinance to close those loopholes. We have dual enrollment problems. Okay, we have people getting enrolled who aren't Cheyenne, and we've seen it. And I think we need to address it. It's something that, again, is controversial, I know, but I think we should look at a sophisticated way of looking at who's a member of the tribe. Instead of requirements, let's look at standards, okay? A standard of what a Cheyenne is. Not necessarily a blood quantum, okay, but I think there's got to be a more sophisticated way to determine who's a member of our tribe. It's a Supreme Court case, we have that right, and right now, all it takes is a claim to be Cheyenne, and you can be enrolled. And I think that's a major loophole. And we've seen it, and we were addressing it months before the PERCAT was distributed. What if we get other types of resources? It all comes down to that, and we're not addressing what Cheyenne-ness or Indian-ness is as far as identity, and I think that can be included with our enrollment.
Okay, and then I want to finish up on that last question. I think we have too many holidays. We got staff that want to work, and they come in ready to go to work, and we're not doing a service to the people with that many holidays. Blood quantum, that's really a non-issue to me. You know, when they created this IRA government to assume, we are not the government, we assumed a certain portion of the duties of the government, and those people smoked on it, and they sealed the deal right then. And that's very important today, because you don't take that lightly. What this means is, when they decided that blood quantum was not an issue, but that you, in order to be enrolled, it was by ancestry. I've never heard of any unverified persons being enrolled, because I've seen the process. My children, my grandchildren have been through the process. You have to show who your relatives are. They have to be enrolled, or they have to show who their lineage is. And you have to provide the birth certificates and everything. So it's a pretty good system. But the main thing is, that was the will of the people when they smoked on it, and they passed it over to the government to enforce. Once that's in place, I don't see the reason to change it. You know, there's strength in numbers. Man, that's a whole bunch of issues there. The people that move off the reservation for employment or school, and there's some people that want to come back to the reservation, I think we have an obligation to create an economic climate here to where they can come back and work in their trade and be well paid for it. If they've gone off and they've got the job training, the education, the whatever it takes, the work experience, then we need to better accommodate them, and that's through housing, having the jobs, raising the job standards as these jobs become open. For those that live off the reservation, I believe they have a right to be involved in that process. You know, our people used to live all the way from North Dakota, all the way down to Mexico in different bands. We got together as needed for certain events, and never lost never lost being a Cheyenne. I think that a big problem though is the voting, this absentee ballot thing and all that. I think we could resolve that by having one off-reservation tribal council person, somebody who resides off the reservation, because as it is right now, they live off the reservation, but when they vote, they have to know which district that they can vote in, and if there's no known district, you got people that may have never lived here, but so they vote in Lamedere district. You know, we could resolve that by adding, this would cause a constitutional revision, adding an off-reservation tribal council member.
You know, you got a chance to say something about the other question. I had a phone call during per cap from a lady, and I played it for the people in my office. I said, hi, this is, I forget her name. I'm a white Indian. You met me at per cap. I want to know how to access IHS because I have no money. She didn't even say Cheyenne, she said white Indian. And this is why I go to meetings, because we're sitting there fighting for scraps. And it's a true story of how our government system is set up. But we're at the table, and the statistics that we give these funding agencies are statistics from our reservation. High rates of diabetes, high rates of dropout, high rates of mortality, I mean, you name it, suicide, substance abuse. These are statistics from our reservation. And I think the idea of an off-reservation representative is a little strange because it's going to compromise what I think is our sovereignty. Our sovereignty is to our land here and the people who reside on that land. And I think that's where me and my opponent have a strong difference. And I look at it because of our people on the reservation. If those rates are so high in our communities here, we should be allocating resources to better that. That's why we're out there fighting. That's why we're out there at the table in DC, because of our homeland here. And I understand that half our population live off the reservation, you know, but I am really a lot more concerned of those living here. That's who I had to go to a funeral today, because of our people here. That's who goes to school here. And to me that means a lot. First of all, I have the idea that sovereignty is inherent. It is not given or taken away, it's ours. And being indigenous and being Cheyenne, we have the right to govern ourselves and our lands. I would protect our lands. I would ensure that no other jurisdictions would encroach on ours. An example is during the fires, our administration wanted to accept some state money for Tongue River Road in Ashland, not knowing the consequences of that. He accepted the money. We said, no, don't accept it. We have an issue of jurisdiction on that road right now. We maintain it, we control it, it's our road. The fact that we're gonna accept money for them to put a fence up for it because it burnt down shows we're giving away some of our sovereignty. I think that's a perfect example of leadership we need at the table, at the state level also, with our compacts, our cigarette gas, our gaming compacts. We need to move forward with the idea that we're not going to wait for the Bureau or the state to tell us what we can and cannot do. We take it inherently. We are sovereign, let's do it. The idea is getting leadership that understands that concept and that can move forward with it. I'm tired of other jurisdictions trying to extradite our people. I'm tired of other jurisdictions trying to pull over our people on our roads. You know, our issue is going to be right-of-ways coming up here, 2023. All our right-of-ways will end. That's going to be a chance for us to get complete control over our land. The other part of that is going to be purchasing fee land downtown here in Lamedere and making our reservation whole along with Otter Creek. We'll be 100% whole as a reservation, probably the first tribe ever.
excuse me, the truest act of sovereignty is when the government of the tribe sits down with other governments, whether it's city, county, state, federal, sits down with them and negotiates some of the agreements. It would be nice to say we're sovereign, that we own this land, but what are we going to do? Who's going to pay for it? You know, the reality is, until we get some sort of economic development, we're going to remain this quasi-sovereign status, which is the legal term. But here's what I believe, and I've said this twice before tonight. Let's not act sovereign, let's be sovereign. Let's make sovereign decisions. Let's put the people before us. Let's act as a government responsibly. And let's sit down and let's work with the county. Let's work with the state. Look at that same disaster. A lot of this could have been avoided. Now, we did have a reservation plan and an emergency response plan. It's my understanding. Something failed in that plan. The other thing was, we didn't have the agreements that we needed with the state, with Bureau of Land Management, with Bureau of Reclamation, with any of these people, that we could have made a joint effort to jump in and stop that fire. These are something that we need some foresight on. We need to think of these things in advance. And to be sovereign means that we have to be true to our people and represent our people well when we meet with the other governments and carry our true values to the table. You know, this is it's sort of a difficult area, but here's what I think. You know, right now we are almost totally reliant on Indian Health Service for health care. What we need to do, we know that there's a lot of services out there that we're not getting. A part of our economic development plan has to seriously include us providing the health care. And if we don't provide the health care, then where are we providing health care insurance, health insurance for every enrolled tribal member? There was an opportunity for that recently, maybe to address that, but that didn't come into fruition. I did hear some talk on that might be something. But that's the reality. We have to sit down with Indian Health Service. And my big goal is to get a dialysis center here. I've heard too darn long, it can't be done, it can't be done. And I've heard all the barriers. And to me, those barriers are not barriers, those are challenges. We need that dialysis center here. And if we look at it, not just a tribal dialysis center, but a regional dialysis center, we're going to be bringing in money from other areas as well, from other sources to help fund that.
You know, I am the vice chairman of the National Indian Health Board, which is a national organization advocating for healthcare in all of Indian country. And we have an opportunity coming forward with Obamacare, with the Affordable Health Care Act, which includes the Indian Healthcare Improvement Act as part of its legislation. We have an opportunity to capitalize on a health insurance mandate that could coincide with third-party reimbursements that could generate revenue for our tribe. We are already lacking the know-how to capture these third-party reimbursements. If most of our community is unemployed, that means they're eligible for Medicaid and Medicare. If they utilize our service unit here, we're supposed to be reimbursed for that services. That's revenue. What I would do is I would make that service unit over here, not IHS, I'd make it tribal. So we can then see the fruition of healthcare dollars. On the other hand, the idea of a dialysis center, I think the other way, because you've seen a paradigm shift in Indian country in regards to healthcare. It's all about prevention. I would move forward with the development of a wellness center, okay? And there was plans already developed to do this, for a gymnasium, swimming pool, track, weight room, saunas. Why not prevent these health disparities instead of putting a Band-Aid on it and having us deal with it then?